starting it.
Good afternoon. My name is Dominique Presentation. I'm going to inform you about about epilepsy in the United States of America. It is a condition that most people don't realize that they have it until later on. Some people are born with it, and some people develop it over time due to head injuries, scar tissue damage, and other things. I'm currently living with the disease of epilepsy. I deal with it on a day-to-day basis. It is a struggle to deal with, and it affects you and also the family members around you. I'm going to go over the steps of how epilepsy affects people and the steps of treating epilepsy when you're having a seizure. According to Joseph Servan, a medical doctor at Mayo Clinic in Arizona, he wrote a piece called "What is Epilepsy?" And he also noted in that piece that 1 in 26 people in the United States of America don't, one in 26 people in the United States of America develop epilepsy at some point in time during their time. The specific purpose is to inform you that 60 million people in the United States are currently dealing with epilepsy, me being one of them. According to Robert S. Fisher, medical doctor at Stanford University, those numbers are true. Epilepsy is unpredictable and life-threatening disorder. It can alter a person's everyday life and their family's everyday life, as I said before. So when you're having a seizure, there's two phases that you go through. There's an ictal phase and then there's a post-ictal phase. And the ictal phase is when you're actually having a seizure and you actually have to, going through whatever seizure you have. Some people, there's different types of seizures. There's grand mal epilepsy, there's petit mal epilepsy, and then there's syncope epilepsy. With grand mal, I have grand mal epilepsy, which is also known as generalized epilepsy. With the ictal phase, like I said, the seizures in progress, and you endure this is when you're on the ground and your body is shaking. Also, you're dealing with a major headache, and you're unconscious. With the post-ictal phase, which is after the seizure, you come to and you're dealing with confusion, and you're also dealing with not knowing who you are, and your body hurts because your whole body has went through epileptic seizure. According to epilepsy.com, epilepsy can gradually or abruptly occur. Some epileptic patients have auras and sensation or smell or feel that occurs before they have their seizure. As for me, I have what they call staring spells, and I also have migraines, and that is when I know that I'm coming onto a seizure. The treatment for epilepsy, for epileptic patients is, the treatment for epileptic patients, or when the person is having a seizure, there are two types of ways you can deal with it. It's an emergency or non-emergency. With emergency, you want to deal with it as you call 911. You always, if you witness the seizure, you want to stay with the patient, and you want to make sure that the patient doesn't have anything in his mouth, in or around his mouth or around him. According to Fred Lewis Hall, ease them to the floor so that they won't fall. Now, she is a medical doctor who's been on the Doctor Show several times related to the case of epilepsy. She has informed the world on how to deal with epilepsy and how people should take epilepsy more seriously. When dealing with epilepsy, you have to maintain maintenance. What I mean by that is you have to take your medicine as prescribed. You also have to see a neurologist on a scheduled regime, and you have to make sure you don't consume any alcohol or use drugs and abuse them, such as marijuana, cocaine, and all those illegal drugs that are illegal in the United States. Um, with epilepsy, people normally they tend to excuse me. Normally they tend to take this in consideration, and their lives are altered as far as what they're going to do for their next step. It also affects your cognitive abilities as well. There's a quote from a journal from uh, all the journal for nursing, and they tell you about how to deal with it as well. Um, this has been my presentation on epilepsy. Thank you very much.